Hi, this is Michael Benner, and I want to thank you for recognizing KPFK as one of the few channels for progressive news in Southern California. There's obviously no shortage of hate radio out there. They're trying to frighten you, and they have plenty of followers. Over 75 million people voted for Donald Trump, so we have to stand strong. Be resolute in our beliefs and support each other. If you're not a member of KPFK, now is the time to renew or become one. Join the resistance. We're the voice, but you are the power behind us. Go to kpfk.org and become a KPFK supporter with your donation. Do it now. We're 90.7 KPFK and kpfk.org. Resistance Radio, powered by the people.
Did you know Intervision is moving to a new time slot? Hey, it's Nita Valens, and I'm happy to announce that starting Friday, January 8th, Intervision will be on Fridays at 1 p.m. So check us out for the latest in psychology, spirituality, and inspiring stories right here on KPFK.
This is Dr. Gabriel Buelna, KPFK Los Angeles 90.7 FM. This is a special program on COVID and equity. And for the hour, we have Dr. Savoy Brummer, MD, and Dr. Sandra Salazar, MD, who are going to be giving us their feedback and a discussion on COVID and race issues in Los Angeles.
One of the major hurdles facing the coronavirus vaccine, getting people to take it. This issue of trust is especially deep in the Black and Latino communities. Even though they are being hit disproportionately hard by the pandemic, mistrust of the government and of the medical community may make some people reluctant to trust the safety of the vaccine.
Today we have a topic that's important for us today. We are at approximately 317,000 deaths in the United States because of COVID-19. Some know it as the coronavirus. In England, there's been a different strain of the coronavirus. And with the vaccine coming up, and the coronavirus has caused a lot of social issues throughout the nation, and we want to have a discussion today on COVID and equity. And in order to do that, we have Dr. Savoy Brummer, emergency room physician, who's going to be discussing the issues of race and African Americans related to coronavirus. And the discussion with Dr. Brummer is going to focus around where we're at with vaccines and the distrust in the African American community, and his opinion on where African Americans should be with regard to trust in the vaccine. Then on the second interview is Dr. Sandra Salazar. Dr. Salazar is also an MD, both guests are emergency room physicians. And Dr. Salazar, who's also a trustee at Cerritos College, is going to be talking about what's happening, again, overall in terms of equity and coronavirus, her perceptions, and what's happening in the multiple Latino communities in the region. And when I say multiple, Los Angeles is made up of not one Latino community, from Salvadoran communities to Mexican American communities to Native American communities, and the multiple communities that make up this one title called Latino here in Los Angeles. So it's going to be intense conversations for the hour. Again, Dr. Savoy Brummer and Dr. Sandra Salazar for the hour. Today we have Dr. Savoy Brummer, MD. And let me give a quick shout out to Dr. Aisha Rando, education instructor in the Department of Behavior and Social Sciences at Los Angeles Trade Tech, for the introduction to Dr. Brummer. Welcome, Dr. Brummer. Thank you for taking the time today.
Well, it's a pleasure to be here. It's a privilege to be able to speak to you and your viewers about, all of the various concerns that the community has in these very trying times. And I appreciate you using your platform to help educate all of Southern California.
No problem, Dr. Brummer. KPFK has listeners in a significant part of Southern California. So, listeners, Dr. Brummer, after receiving his medical degree from New York University and completing his residency at University of Pennsylvania, Dr. Brummer practiced emergency medicine across the nation while attaining academic posts at Washington University School of Public Health and St. Louis University School of Medicine. Notably, Dr. Brummer has also been the recipient of the prestigious Blue Jay Consulting EMF ACP Director of the Year Award. Again, welcome, Dr. Brummer, and let's get at it. So today, Dr. Brummer, you as an expert on health diversity here in Los Angeles, as of today, we have 317,729 persons who have died. We have 2 approved vaccines. But you also have something that you haven't seen in a while, which is a strain from England that is new and that folks are concerned about. In fact, all trade between England and mainland Europe has been stopped for, I believe, 48 hours. Before we get to some of the questions, can you educate the audience about maybe some of the concerns that they may have, and does the vaccine work with any new strain? What are some things you can tell us before we get to our main conversation here?
Sure. Well, a virus mutates regularly, right? So if we look at influenza, there's a reason why you have to take a flu shot every year, because there are slight variants as the virus jumps from host to host. So, a virus mutating is a natural evolution of the virus. It's something to be expected. And so the trick is, when you develop a vaccine, is to develop a vaccine that targets a very specific thing that's on the shell of the virus, which typically does not mutate frequently. And so, it's always like, I think a great analogy was, if I'm wearing a blue coat or if I'm wearing a gray coat, it's still the same person in the coat, right? And so the thought is right now that vaccines that have been created will typically have some degree of effectiveness towards any of the mutations that exist. When we look at England, we see that there is a new variant that could possibly be transmitted more easily than the other variants which are out there. And again, we've had many different strains of COVID-19, and that is very, very clear at this point. But because this variant has only recently been detected, we have to do our due diligence and understand exactly what that means as it relates to how easily the virus is transmitted from person to person, if the virus has either greater or less morbidity or mortality. Typically speaking, those viruses that jump very easily from host to host, they actually are less effective, right? I mean, when you look at viruses through time, they're typically they have very large amounts of morbidity and death, but throughout time, they developed means for it to become longer lasting, and what you call the virulence, or the amount of disease which a virus brings, it actually lessens in time. So we have to go and take a look at the genomic footprint that that exists there in England. We will then go and see, we want to make sure that the vaccines that have been made continue to have some type of efficacy. By the way, all the vaccines kind of are targeted to a specific spike protein on the virus, and we want to make sure that hasn't changed. But the vast majority of virologists and infectious disease doctors believe that the vaccine should still be able to offer a high degree of protection. Again, this will take time for us to have a better understanding as to if that is true or not. And by the way, when you look at the United Kingdom, we're not exactly sure why it's spreading. It could have been just a huge super spreader event that has kind of gone in overdrive. there are just a lot of questions, but we've got the world's best taking a look at it, and I'm actually very optimistic, as well as the medical community, that our viruses will be able to have at least if not the same, but at least some moderate degree of effectiveness towards this new strain.
Thank you very much. And I want to remind listeners, this is Dr. Gabriel Buelna, KPFK Los Angeles, 90.7 FM. I'm here today speaking with Dr. Savoy Brummer, emergency room physician. After receiving his medical degree from New York University and completing his residency at University of Pennsylvania, Dr. Brummer practiced emergency medicine across the nation while attaining academic posts at Washington University School of Public Health and St. Louis University School of Medicine. So speaking of vaccines, the Associated Press and the University of Chicago conducted a poll between December 3rd and the 7th. And they asked the question, do you plan to get vaccinated against the coronavirus? And then among whites, 53% said yes, 25% said no, and 22% not sure. Among black African Americans, 24% said yes, 40% said no, 37% said yes. And among Latinos, 34% said yes, 26% said no, and 41% not sure. So a higher level of not sure among Latinos, but among African Americans, 24% saying that they plan to take the vaccine, and a super high number, 40%, saying no, and a smaller percent saying not sure. Can you share with our audience what do you think is behind the high level of concern among the African American community with regard to the coronavirus, and have you taken the vaccine yet?
Sure. Well, to all the viewers, I'm actually an African American physician. I'm an emergency medicine physician, and as you had said, I manage many of the emergency medicine visits in the state of California. My group sees over 7 million emergency visits nationwide. And that's from coast to coast. And I'll say this, that I actually got the Pfizer vaccine on Friday. I had, other than a sore arm for about 24 hours, I am 45 years old. I went jogging with my 13-year-old daughter the day after, and I've had very little side effects. And I wanted to make sure that was a very public visual for the African American community, in that they need to see that their African American leaders, not just in government but in healthcare, are very much so encouraging them to take this vaccine. If you look at people of color in the black and brown communities, we historically have had huge healthcare disparities as it relates to access to care. Many of these healthcare disparities result in poor outcomes for black and brown communities as it relates to white people. And so the traditional understanding of the importance of healthcare, of vaccinations, of dealing across a huge spectrum of illnesses is not necessarily received in the same way because of increases of resistance to access. So specifically in the black community, if you look at the history that medicine has had, it's not a streamlined type of thing. If you look at the Tuskegee experiments with syphilis, if you look at experiments, especially historically as it related to early vaccinations with African Americans, if you look at through slavery how African Americans were experimented on. I mean, I, as a part of the medical community, I can definitely tell you that these relationships have been tricky, to say the least. What is truly unfortunate is that access to care has been withheld to black and brown communities, right? So we are usually the last in line to be able to receive new therapies due to their cost, due to our demographics and having hospitals which are readily able to distribute many of these new medicines. And so we now have come to a point in our history where we are able to have a seat at the table to help direct vaccinations for our community, to actually protect our communities. But now the historical imprint of segregation, of an unequal distribution of healthcare has now made many African Americans very hesitant towards getting that. And that is the absolute worst thing that can happen to a community that is in need, right? I tell folks all the time that the Black community has been affected by COVID-19 from a financial aspect because many of these small businesses that are owned by African Americans, they're out sick. We've got folks that can't open up their shops. And without getting folks vaccinated, we're not going to be able to reopen many of these small businesses. So I try to just tell folks, do not let your historical perspective of healthcare and medicine affect this choice for you and your family, right? Because it's going to create devastating health and financial effects for you and your community.
Dr. Brummer, essentially, I believe what you're saying is, at this point in history where we're at, if you're African American, should you trust the vaccine and take the vaccine?
Sure, and that's an absolute, unequivocal yes. You must get out there. You must protect your family. I can't tell you the number of young, in your 30s, African Americans. I've got hospitals out in Atlanta where we have intubated numerous African American, young, healthy African Americans for COVID-19. It's really troubling that people look at these outcomes, and I think that now, as it's been exploding, people are starting to have some personal connection and having, aunts and uncles and brothers and sisters who have had some very poor outcomes. But it shouldn't take it to be thrown in your face for you to understand that, this is a devastating disease. It is now the leading cause of death in America. Okay, this is not influenza. Again, let me repeat. COVID-19 is the leading cause of death in America today. And if you can do anything to protect yourself from that, taking a vaccine there's no comparison amongst the benefit for Black communities in being able to survive this truly devastating disease. So please, when it becomes available to your age group, when it becomes available to your local communities, please understand that this is so small in comparison to, again, not just the death, but even people who, I'll give you a great example. There's a young person who technically survived, right? Everyone looks at the death rate, but who survived. This young person had a kidney infarction. In other words, it clotted up the blood supply to their kidney, so they had to take out their kidney, and also had a huge stroke on the right side of their brain. Now, this person has survived, but that's not what we should be looking at in terms of, the outcomes that are desirable, right? Even the people that are surviving, there's a substantial number of those who are going to have lifelong consequential illnesses that we haven't even been able to determine. So I just implore, everyone to understand the significance of this and to put down the bravado and to say, that this isn't, the vaccine isn't worth it. Because the outcomes that I've seen across my 7 million patient visits have been absolutely devastating. So please, before the vaccine occurs, practice your social distancing and wear a mask. But when it becomes available, this is by far the better outcome. I'd rather take some muscle aches and some fatigue for a couple of days than, again, the lifelong ramifications of having COVID-19, again, throughout multiple age groups.
Dr. Brummer, thank you very much. And I want to remind listeners, this is KPFK Los Angeles 90.7 FM. I'm your host, Gabriel Buelna, and we're with Dr. Savoy Brummer today. Dr. Brummer, in an article, in essence, you mentioned that what's most devastating to your soul is learning of colleagues and friends, frontline workers that you've known for years contracting or even dying of coronavirus. Could you expand on the effect of coronavirus on African American frontline workers, healthcare workers, and also expand a little on a post-COVID agenda in order to try and deal with equity issues in health?
Sure. I mean, being an African-American physician, many of us actually went to historically black colleges and universities. And I went to Howard University, and, at the time, you never know once you graduate from college what people will end up doing. Many of them ended up going to the healthcare community. One of my really good friends, who was a frontline pharmacist, passed away early on. And he was doing his job, had a small family of two little girls out in the Washington, D.C. area. And that was just the start of a cascade of African-American frontline folks who I've known who have gotten tremendously sick, as I stated before, and also have unfortunately passed away. And again, hearing the response of the black community, not necessarily being receptive to change, and again, understandably being hesitant to some of the words and the media that are coming out. We as frontline black physicians, black EMTs, black nurses, black pharmacists, black secretaries at hospitals, black phlebotomists, we take this personally. We take this as our families and our communities, and we want to keep our own families safe, right? So every single time one of us goes to a shift in the ER or to the ICU or is in an ambulance, we risk not only ourselves, but we risk our family and bringing back COVID-19 to our family. So this is a very difficult time, especially if you consider, again, African Americans not necessarily having the same outcomes as other groups. It's a scary time for folks. There are so many heroes that are out there. I've got friends who were out in Brooklyn during the first wave that are really carrying on. I got friends out here during this wave in Los Angeles, friends that are down who are anesthesiologists that are working down in Texas. And all of us feel a sense of servant leadership, of community, and honestly just some real remorse, right? Because when we see folks who are not necessarily putting on masks, when we see people who are not taking this seriously, it hurts our soul, and we see just another assault to black health in America. And it's when I spoke to Essence in that article, I just wanted to educate folks on not just the seriousness, but it really is up to each person as an individual to take that accountability. We can treat you when you get into the hospital, but we would prefer that you never come in. We would prefer that you never got sick in the first place. But this disease preys on community, which is strong in black people. It preys on relationships. It preys on multi-generational households living under one roof. Again, black and brown communities. It preys on people who, again, if you look at black folks, many of us live check to check. We don't have multiple generations of wealth to avoid going out into the community. And so, we see how people have to make the choice between working at the local grocery store or working in their small business and possibly getting infected with COVID that other communities that are more affluent may not necessarily have to make. And so, again, we take our jobs as frontline healthcare providers really seriously, but we just ask for people to take the due diligence, use hand sanitizer, wear a mask, try to be as far apart as other people as possible, and to not prey on, your own sense of mistrust, because it's just going to cannibalize your own health. So, I'm just really proud. I just want to give a shout out to all my partners at Vituity. We're trying to address many of these healthcare disparities that exist But to all of you who are listening, I mean, guys, this is hurting your frontline folks. You guys not taking this seriously, it's hurting us, man. It's the morale is not high. So please take it seriously.
From where, and this will be the final question, from where you've seen the narrative related to coronavirus in terms of the Black African American community in January, February of 2020, and where we're at today, where is the narrative where it needs to be? And if not, where should that conversation go? And also, is there anything that you would like to add for our listeners? Sorry, not viewers. We don't have any secret cameras here at KPFK. For our listeners, tell us something we should know about the coronavirus. You, as a physician, as a well-respected physician and entrepreneur in our community.
Sure. I want to address the last thing first, which is, we have COVID testing that's available throughout America. But just because you have a negative test does not mean that you that you don't have COVID-19, right? It usually takes at least 4 or 5 days of exposure for you to have enough of the virus in your system for you to have that detected by even the most sensitive test. So the most important thing that everyone can do is continue to wear a mask, to socially distance, and to stay outdoors. Even I know there are different parts of the country that are cooler, but to stay outdoors as much as possible. These types of things will save lives. The intermixing of households, unfortunately, during this holiday season, it was devastating over Thanksgiving, and we're seeing that, especially locally here in California. But if we do this again during the Christmas holidays, already the ERs are overburdened, our hospitals are overburdened here in California. It's going to be truly devastating. So, my request for everyone is to take this seriously over the holidays. I always say a Zoom Christmas is better than an ICU New Year's, right? So please take this seriously. And for folks in the African American community, we're all about family. Let's just do it in a safe way, and let's pick it up for next year.
Dr. Savoy Brummer, thank you very much. MD, emergency care physician. Let me just say, local hero. We want you to please stay safe. We need to have dozens more conversations.
Thank you very much.
Thank you.
You're listening to KPFK. Happy holidays.
When you wear a mask, you're protecting yourself and everyone around you. Wear a mask.
There's a lot to be thankful for. If you're thankful for the old family vehicle, you can let it help one more time by donating it to the KPFK Vehicle Donation Program. The proceeds will help KPFK continue the quality programming you depend on throughout the year. The vehicle donation number is 877-KPFK-AUTO. That's 877-573-5288. Our representative will take care of everything. That number again is 877-KPFK-AUTO, or donate online at kpfk.org.
The Broadcast.
Experts have said that the case has little chance of success at the Supreme Court, much like the numerous other GOP election lawsuits that are pending in battleground states. But then again, those experts, they are just guessing. They are hoping.
With your host, Brad Friedman, and producer, Desi Doyen.
There's enough going on right now. There are enough X factors still remaining that's one I'd rather not contemplate.
Correct. You are, as usual, correct, Desi Doyen.
Tune in to the Broadcast every Monday at 3 p.m. right here on KPFK.
This is Stanley Clark. Free Speech Radio can't survive without your generous support. Become a KPFK sustaining member now by pledging $1 a day at kpfk.org. Become a sustaining member. Your donation is tax deductible and membership has its privileges. I am a member, so join me, Stanley Clark, in keeping independent radio alive. Donate to KPFK at kpfk.org and do it today.
This is KPFK, The Michael Slade Show.
There's something that you keep bringing up in your book that really struck me, that fascism seeks to replace truth by power, and that there's a very particular method to doing that. Let's talk about that.
So truth balances out loyalty. If we recognize the truth, if we recognize facts, so I don't mean like a deep truth. So people think that the Russian language makes a distinction between deep truth and truth. So that's why that covers propaganda. You lie, but you lie to reveal a deeper truth.
Michael Slade Show, Friday mornings at 10.
Democratic culture requires that people are humiliated when they lie about ordinary facts.
This is KPFK.
Germs are spread in person. During the outbreak, video calls are best for in-person meetings. Practice social distancing.
What we're seeing now, is the culmination of years of research which have led to a phenomenon that has truly been unprecedented. And that is to go from the realization that we're dealing with a new pathogen, a virus that was described in January of this year, to less than 1 year later, to have vaccines that are going into the arms of so many people, including myself. For me, it's important for two reasons. One is that I'm an attending physician here on the staff at the National Institutes of Health Clinical Center, and so I do see patients. But as important or more important is as a symbol to the rest of the country that I feel extreme confidence in the safety and the efficacy of this vaccine, and I want to encourage everyone who has the opportunity to get vaccinated so that we could have a veil of protection over this country that would end this pandemic.
This is Dr. Gabriel Buelna, KPFK Los Angeles 90.7 FM. This is a special program on COVID and equity. On the phone right now, we have Dr. Sandra Salazar, MD. Dr. Salazar is also a trustee at Cerritos College. Dr. Salazar is again, like I said earlier, MD, but she's working in urgent care. Dr. Salazar, thank you for taking time out of your day. Right now, you are working, correct?
Yes.
Okay.
Definitely, and we're working today.
Okay. So, in the last 24 hours, we've heard that there's a new strain of COVID-19 out of England, and they're quarantining the entire island. Here in Los Angeles, first, have you received the vaccine? And what are you seeing on the ground that is different from the last few months?
Well, yes, I received the vaccine on Friday. We were definitely there was a sense of excitement when the shipment came last week, I believe, to LA County, and Kaiser received some vaccine to different medical centers last week, and we got an early notice that we could get vaccinated on Friday. So definitely I didn't hesitate and got the vaccine as soon as possible. And currently, they're only vaccinating frontline workers, people in the hospital, people in urgent care. Those are the first people getting vaccinated.
Dr. Salazar, what do you right now, as of today, are you concerned with what you're hearing about the different strains in the United Kingdom and literally the entire island or the entire United Kingdom being quarantined? Does that concern you or not concern you?
It's definitely concerning, but I think we just need to get through this current wave and this current surge of cases. I think before we can talk about England and the new strain, we need to talk about what's happening right now on the ground currently in our urgent cares, in our hospitals, in our emergency rooms, where there's not enough room. People are being treated in hallways. They're not getting adequate care. There was a memo sent out by LA County saying that it will be expected that patients will get possibly substandard care, not because we can't provide it, but because the system is overwhelmed. And I think, we're still seeing that wave from Thanksgiving. We still have to get through Christmas. We have to get through New Year's. So before I think we can talk about the new strain, we need to talk about the current state of our hospitals and our medical system, and how if you look at LA County, you see a disproportionate amount of Latinos being infected and also a higher mortality. And I would say it's more than triple compared to other ethnicities, and that's very concerning.
So, Dr. Salazar, literally we can hear the sirens in the background. You took time from being right now a frontline worker. Tell us what you're telling us something of what you're seeing, but can you be a little more direct with the listeners, because we need for them to take this extremely seriously. So be a little more explicit with us.
Yeah, I mean, I hate to be, I think there's no way to sugarcoat it. The system is overwhelmed, and we have our Latino community that is being adversely impacted by it. Why? Because there are really our essential workers. They're the ones, I just saw a patient this morning who is he's a janitor for Farmer John's, and he's coming here with COVID symptoms, and I'm like 99% sure he has COVID, right? So it's the Latino community who are working in supermarkets. They're working as cleaning. They're doing all those essential jobs, and they have to work. So they're not staying home. They're taking public transportation. And if you look at, I can tell you firsthand, I mean, we're nonstop. We're seeing patients coming in, being exposed, having symptoms, needing to get tested. They're hesitant to stop working because if they don't work, they don't have food on the table. We have our hospitals that you have 8-hour waits. We have our morgues that don't have the space capacity for the number of people that are dying per day. And an unofficial report was that we had 10 people die at the hospital when normally it's very few, maybe 0, maybe 1. But here we're having 10 people passing away, likely due to COVID in one shift. We have we don't know where to put the people who passed away. Our morgues are at capacity. We just don't have the space. We did see that note from Governor Newsom that they just ordered 5,000 more body bags. I mean, I think this is an emergency situation, and I think people need to take seriously that they need to stay home. It's Christmas, and people, you see them shopping, you see them at the store, but the safest place to be is in your home. Obviously, masking is definitely needed, but more than wearing a mask and going to the store, it's better to stay home. That's the safest place you can be at this point. So I just don't know how to stress it enough that we're really in a critical part of this, and there's a surge, and we haven't peaked yet. There's no end in sight. We still have to get through the surge after Christmas, the surge after New Year's, but we're already having difficulty handling the situation, and this is just Thanksgiving surge.
So Salazar, tell me, just as an individual, how is this affecting you?
Well, I mean, I think it's taking a toll on us emotionally as mothers, as physicians, as community members. I think, it's not easy. I mean, I think I understand we're 9 months into this pandemic, but this is not the time to really let our guard down, because I believe the statistics are that 1 in 80 people are infected, which means when you go out to the store shopping, you're going to run across people who have the virus. And that's a fact. And that's so now every small little trip you take to the store, to the post office, there's more chance of you being infected because we have more infections more than ever. So any little trip outside your home, it's riskier now than it was 3, 4, 5, 6 months ago. But I'll be honest, it definitely takes a toll. I have 2 small children, a 6 and a 7-year-old. While they do schooling at home, I have to go to work, take care of patients. So definitely it takes an emotional toll. But I think this is not time to really focus on that. It's about survival and really getting through these next couple weeks.
This is Dr. Gabriel Buelna, KPFK Los Angeles, 90.7 FM. Here speaking with Dr. Sandra Salazar, MD, Cerritos College trustee, and also urgent care physician. So in terms of the Latino community, so in Los Angeles, we have a very diverse Latino community. Do you see the majority of COVID, do you see it immigrant? Do you see it Spanish speaking? Do you see it bilingual? Do you see first gen, second generation? Is it hitting Mexican Americans more than Central Americans? What are you seeing? Is it hitting Latinos just equally across the board? What are some of your insights?
I would say it's hitting the Latino community as a whole. And I think it's because you have some multiple generations in a home. We might have the mom and dad that are monolingual, that are Spanish only, but then we have, say, the college child who's also in the home and now who's exposed and now having symptoms. And it might be that maybe the mom or the mom or dad was the essential worker, but it trickles into the kids and the grandkids, right? So I think it's hitting everybody equally, and I think it just the Latino community really has those essential jobs. They're working in the grocery stores, they're cleaning buildings, they're working in the food plants. So I really think it's affecting people equally because of the types of jobs that the Latinos hold.
So if you're a Latino elected official, if you're an advocate of an organization, if you're and if you're looking at where to put your resources, specifically with the Latino community, what would you say you would have them do at this point with regard to their advocacy for this community? More PPP, more what? What is Los Angeles missing that you're seeing a specific spike specifically in the Latino community?
Well, I think we're missing our politicians advocating for the Latino community. I think that politicians need to do a better job in advocating for the Latinos who really don't have a voice. For example, our farm workers. People should be advocating for our farm workers. They are not, usually they're pretty much seen as invisible, yet they provide that food on our table. Yet no one's advocating for their health care, for sick paid leave, for testing, for PPE, for, vaccine. We don't have that, for those vulnerable communities. I mean, we have obviously a subset of patients that are Latino who have insurance, and they should be okay. But what about the ones who are uninsured? We really need to start fighting for those patients that don't have a voice.
So you mentioned a patient, in the meatpacking industry. So Los Angeles has. So you mentioned farm workers. So what other industries are specifically getting hit that you're mentioning within the Latino community and other communities of color as well? But you're saying that there is a lack of advocacy within leadership in Latino communities. Why? Why is there a lack of advocacy?
Good question. I mean, I think one is really having our politicians step up and really advocate for these communities. But another one is, are we putting money into raising awareness? Part of the issue is that the COVID-19 and now with the vaccine, it's really we've sped things up a little bit. Normally, there's more thought put into these campaigns of raising awareness, so our communities are educated and informed. But right now, there's a lack of reliable information, and there's probably mixed information coming out. So the part of the issue is that we've had to respond to this very quickly. So so the thing is, we haven't really had time to really roll out a more organized, concise message to raise this awareness. So one, I believe, is just lack of resources.
Are we seeing the consequence of lack of Latinos who are in the medical field as MDs, as nurses? Are we seeing those consequences right now? Are Latinos represented well in those industries?
Well, we always had a misrepresentation, an underrepresentation, sorry. Considering the population we have, there's always a small percentage of minority physicians to really provide care to our own communities. And that's been a longstanding problem. But I think now more than ever, we need to highlight those voices to try to help give patients that trust that they need to know that they should take the vaccine, to know that they should stay home, to know they should get tested.
Dr. Salazar, so in the AP, Associated Press, and the University of Chicago came out with a survey, and the question was, do you plan to get vaccinated against coronavirus? Among whites, 53% said yes, 25% said no, 22% unsure. Among African Americans, only 24% said that they would take it, 40% said no, 30% said not sure. Among Latinos, 34% of Latinos said they would take they would take the vaccine. 26% said no, and 41% said not sure. So, between the high level of whites who say that they will and the low of 24 of African Americans who are saying that they will, Latinos around 34%. What's the ambivalence that you're seeing among Latinos about a vaccine, and what would you say to them about the vaccine?
Well, I would definitely say that the vaccine is really what's going to get us out of this difficult time. But the problem is, in order for it to work, people have to get vaccinated. And I think right now, there's a lot of mistrust. There's a lot of misinformation. People do express that they're concerned about side effects, whether the vaccine actually contains the virus. And I will say that the vaccine has been FDA approved. It's been vetted by physicians. It does not contain the virus, and the side effects are very minimal. We do see side effects, but I believe it's been only 6 allergic reactions in over 200,000 people vaccinated thus far. So the vaccine is safe. And I think that definitely, if it's not for you, think about your loved ones and the people around you. A lot of wearing a mask, keeping distancing, staying home has to do not only about yourself, keeping yourself safe and healthy, but also keeping your family members healthy and your inner circle healthy as well. So it's not just about yourself, it's about your community too. This is Dr. Gabriel Buelna, KPFK Los Angeles, 90.7 FM. Here speaking with Dr. Sandra Salazar, MD, Cerritos College trustee, and also urgent care physician. So, Dr. Salazar, so you have among the Latino community, in our with the previous guest, we interviewed Dr. Brummer, who spoke about the mistrust of the African American community and the healthcare system, and experiments that had been done on African American communities in the past. Do you think that there is concern and mistrust of the healthcare system of Latino communities here in the United States? I think. And I think when it comes to African American population, I think there is they have a lot more reasons to mistrust the healthcare system because of so many things that have happened in history with African Americans. And I think in terms of Latino, we're talking about the highlighting of the extreme racial disparity that we knew already existed. And I think it's multifactorial. It's social, it's economic, it's environmental, and it's all the healthcare. So I think for the Latino community, it's a little different in the sense that we have all these inequities that now are being highlighted because of this pandemic. But the mistrust is there as well. But I think it really boils down to those inequities that are being highlighted. And I think a lot of it has to do with the vaccine actually getting to these communities that have been disenfranchised for so long. Thank you, Dr. Salazar. So since the pandemic started, how do you think the perception of the pandemic and coronavirus has evolved within the different Latino communities, or maybe there's one perception as a whole for the Latino community? How has the pandemic changed? And I apologize for interrupting, but I want to make sure and be respectful of your time, because you did take time out of your workday to speak right now. The question is, are Latinos taking the pandemic more seriously now that we're almost a year into it, at the bottom line? I think so, just because, I read an article where a majority of the management and many of the workers in a Food for Less grocery store were all infected. So when it hits close to home, I think people take it seriously. When you have actually loved ones and people who actually have the virus, I think people, will take it more seriously. And I think now, because of the number of cases and the current surge, I think people are taking it more seriously. But at the same time, I think other people are still not taking it seriously because of the holidays. So I think we have a mixed bag. I'm not really sure that it's really changing anything, just that more people are getting sicker, more people in the hospital, yet we still have behaviors that are going to continue the rise of these cases.
So, Dr. Salazar, in the 2 minutes that we have together, you're also an elected official. You're a trustee at Cerritos College, and I believe Cerritos College has an enrollment of around 30,000. So you're an elected official also. How do you inform your decision-making as a trustee of tens of thousands of students with your knowledge as an MD, and where do you think this is going to affect not just Latinos, but African Americans, Asians, Native Americans, and poor folks here in our region? What are you seeing also within higher education? And I think we saw earlier around I think we're expected to see 41% of Latino and African American small businesses going out of business because of the pandemic. So what's the role of education here? And you as an MD, how do you marry those?
I think this was perfect timing for me to serve in a leadership position. That's why, in terms of people serving in public office, it's nice to have a diversity of people, but also professions. And I think in this case, my profession has blended in well with being a public official and really advocating for our campus, which is over 16,000 students. And I feel blessed that we have had leadership. We have a president that believes in science at Cerritos College. And I think the key is we need to follow science. And early on in the pandemic, when I started seeing trends at work in urgent care, and we started seeing that this pandemic was really going to really affect our lives and really affect on how we do business, how we do schooling, how we carry ourselves and our behaviors, we really put an end to we had to move into online learning really quickly. And because we had great leadership believing in science, I remember speaking to him many times early on and saying that we need to start preparing for this as soon as possible. And he really kind of took the lead with that. And so we moved on to online learning early on. Now, the concern is because our students of color really normally do not do well with online learning, we really have to make sure that we're helping our students as much as we can and making sure we're not losing our students because of the transition into online learning. At this point, we have to focus on our health first and what we need to get done in order to overpass this surge in this pandemic. But I think we're going to have to look into, we continue to look at really how we can best serve our students under these circumstances, because it's a challenge. I mean,
Dr. Salazar, with the last minute that we have together, if you are a Latino elected official or an elected official that deals with large Latino communities, what is tell us the top two things of an agenda for Latino public health after the pandemic?
Well, I think access to healthcare would be one. Improved testing within our communities of color, and also vaccine availability. I think those are the things that we are going to. The vaccine is yet to be available to anyone in the community outside of essential healthcare workers. So it's going to take a while. So I think we have time as we start getting more vaccine and it becomes more available, but we need to really have a good system in place about access to healthcare, access to testing, and access to the vaccine, but also a campaign to raise awareness so that our communities of color are more educated and informed, because right now there's a lack of reliable information and we really don't have any campaign to really address those issues and concerns.
Dr. Sandra Salazar, you're about to return to your urgent care position. I want to thank you for taking the time and to informing our listeners as to issues of equity and COVID-19. Please be safe and with yourself, your patients, and your family. Thank you very much. Muchas gracias.
Thank you. Thank you.
Take care.
Bye.
Bye. So for the hour, we had Dr. Savoy Brummer, emergency room physician, and we had Dr. Sandra Salazar, of urgent care physician. And I think what we got from both of them is the word trust. And in terms of communities of color, but specifically speaking in terms of Latino communities, African American communities, Native American communities, both doctors said, take the vaccine. Both of them also illustrated that they took the vaccine. And there's an understanding that there's a mistrust of government in the United States with regard to all people of color and experiments and all kinds of bad things that we all know. However, as people are making decisions about the vaccine, I think both Dr. Brummer and Dr. Salazar said, please take the vaccine. And they also said, please stay home. Protect the ones that you love. This is extremely serious. And when you have two highly qualified, highly educated folks who are working with the individuals who are getting sick and that are dying, and we heard Dr. Salazar saying that she's seen 10 deaths a day occurring where normally it's either 0 or 1. Folks, Los Angeles, take this extremely serious. To love your family is to right now maybe not see them for a while. Communicate, use Zoom. It's difficult, we all know, but we need to keep all of us alive. Thank you.